Hi everybody out there. I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. And today I want to talk about PRF. Well, what is PRF? PRF stands for platelet-rich fibrin. And platelet-rich fibrin is what we very often use when we're doing a surgical procedure to enable that procedure to heal more rapidly, more effectively, and perhaps better. And what does that mean? Well, what we do is we actually draw your own blood, and we take that blood and we put it in a centrifuge, which spins it very rapidly and separates it into certain sections. We take one of those sections, that's kind of like a gel, and we flatten that out, or we shape it however we need to shape it. And then when we are doing certain types of surgery, we very often will take this membrane that we've created from your own blood, so it's not a foreign substance, and place it into that surgical area, and then close the surgical area up as we normally would. But the PRF really enhances the healing, it speeds the healing, it's not a foreign body, and we feel it just makes everything so much faster, better. The healing works more rapidly, and I think we get a really great overall result. Particularly helpful is this PRF that we use. So we were one of the first offices in our state to incorporate it in our procedures, and we use it routinely. It's a great adjunct to what we do, and it's really helpful for our patients and in the process of healing. At any rate, remember, keep your mouth healthy. Healthy mouth means your body's going to be healthier. Any questions or comments we'd love to hear. We'd love you to subscribe to our YouTube channel. So have a great day.
Fibrin, PRF, is a wonderful material. It's loaded with growth factor. It promotes wound healing, bone regeneration, graft stabilization, wound sealing, and hemostasis. So this is the PRF, and let's talk about how it's attained. First, we're going to perform a phlebotomy and draw blood from the patient into these vacuum vials. And normally, you'll draw at least 2, sometimes 4, sometimes 6. These vials have a negative pressure and they draw the blood into the vial. You want to have an even number of vials. If you don't, you need to have a vial, an extra vial in the centrifuge, because there needs to be a balance with these vials. I'll show you that in just a minute. You put them in the centrifuge, so if there's a vial here, there needs to be a vial here. A vial here, there needs to be a vial here. It needs to be balanced. So for some reason, you only drew 1 vial, or an odd number of vials, you should put another vial on the other side. And we're going to centrifuge these. We're going to spin these for 8 minutes. Now, we always do a double spin of 16 minutes because it seems like the PRF is not completely formed most of the time after 8 minutes. So we run 2 cycles. And the way you do this, so you don't have to wait on it, is if you know you're going to use PRF, in our case in dentistry, it's going to be for bone grafting. You're going to use it with freeze-dried bone, or possibly just separate for socket preservation or adding volume to bone. I spin the PRF before I'm doing my surgery, so I'm not performing the surgery and then having to wait on the PRF to spin for 16 minutes. The part we're going to use is the yellow part. See, this is the blood clot, and the yellow part is the PRF that's so rich in growth factor and enhances healing. So just cut that off. We're going to put it on a perforated tray. We'll soon have another video on bone grafting, and I'm going to talk about when do you use freeze-dried bone alone, when do you use PRF alone, and when you use PRF combined with freeze-dried bone. It's very simple, and we'll have that video soon for those of you that are subscribed to dentistrymasterclasses.com. You see, it looks like a little caterpillar, and you put this on the perforated tray. So in this case, obviously, we had 4 vials. These are tissue forceps that I'm using to pick up the clot. Okay, so this is attained prior to my surgery. Then we're going to put this lid on the tray and let that sit. And after about 5 or 15 minutes, it's going to flatten the PRF clots. And it also pushes the serum in the clots through the perforated tray, so you can draw that serum from the bottom part of the tray, and that's also high in growth factor, and you can use that to mix the PRF with the freeze-dried bone as the liquid part. So this video is on how to attain PRF. We're going to have another video on how to use it once you attain it. What do you use it for?